Well, welcome to this series that I'm labeling Reflections from Pharmacy Leaders, Advancing the Profession. It is my pleasure this afternoon to welcome Dr. John Murphy, who's a professor emeritus at the University of Arizona and former Associate Dean for Academic and Professional Affairs at the University of Arizona. Significant in his journey, he's a past president of ACCP, the American College of Clinical Pharmacy, and also past president of ASHP, the American Society of Health System Pharmacists. He's written a book on numerous updates to the book on clinical pharmacokinetics, and he's recognized as an educator and a leader in service to the profession of pharmacy. So I welcome Dr. Murphy. All right.
Able to do this.
Thank you. I thought I was reading your lips there for a while. Okay. So the first question, what we'd like to do is if you would share with us your journey in your career, to your ultimate recognition as a leader. And in that reflection, you may want to include key events or people that influence you in that journey. So John, it's all yours.
Well, thank you very much again for considering me for this. I guess that means I have achieved something, but I do appreciate it very much. Thinking of the people that have made a major impact on my career and how I got to where I seem to be today, I began, of course, with my parents. They were leaders to me. My dad was a leader in the union of the sheet metal workers in Miami, and I was able to observe him influencing other people and saw the quiet way that he was able to make things happen in that organization. My mother was a quite vivacious person who was outgoing and talked to everybody, and though I think I'm pretty shy, she let me figure out how to interact with people in a way that would be beneficial to them and me, I guess. There were obviously some specific teachers along the way. So one I remember from my elementary school that I had for 2 years that really taught me to want to learn better. And in pharmacy school, there were really some key individuals there that changed me from a low B student to a straight A student in PharmD school, because they let me see how important it was to care about learning and to do things right. Because I think before I had kind of studied for my exams and did okay, and then they showed me that there was more to it than just trying to get a good grade on an exam. In pharmacy school, I joined Kappa Psi, and there were some leaders there that encouraged me to attain leadership positions, and so I did that, and that was very beneficial to me as well. I think along the way, and something I'll talk about a little bit later on, how to move forward as a student, along the way, my volunteering for committees and serving on things like that with other dedicated pharmacists really made a difference in my life, to see folks that really cared. Some days at your work, people are dedicated, but you just don't sit around and talk about important issues in pharmacy. And when you're on committees or boards, that's what you do all the time. And it really makes a difference in how you feel about the profession. So those were important. The CEOs of the major organizations, ASHP and ACCP, Joe Otis and Henry Manassi for ASHP and Mike Maddox at ACCP, all influenced me greatly in helping me to think about the bigger picture, a very important aspect. I would be very remiss to not mention students, because students have done much to excite me throughout my career and make me want to be a better faculty member and a better pharmacist. And then the faculty and administrators at the colleges where I worked have always supported me and made a big difference in my ability to become a leader. Obviously you can't be president of ASHP or ACCP if you're not supported by the people that you work with. So that was critical in my ability to attain leadership positions. And those are the groups that made a big difference to me.
Thank you. Okay, and that's very good. Thank you very much for that. So one of the questions I ask is, what do you believe will be your legacy in 20 years? In other words, and I rephrase this because sometimes people don't like legacy. Often people think of legacy after one has left the world. But of all your contributions, what are you most proud of in terms of contribution that has helped you to advance, the pharmacy profession?
Sure. And you know, it's interesting if you think about that when you're the president of a major organization, and it's important to realize that you're just a part of the ship that is sailing forward. So you do things, but it's with guidance of many other folks. So I would never say that, you know, any of the things that came out of my presidential years were, you know, overwhelmingly came about because of what I did. It's a joint working effort, and that's how you help move major issues forward. So with that said, I want to make sure that, you know, I'm standing on the backs of others as I move forward, for sure. I think, you know, obviously you mentioned I was president of 2 major organizations. There are not that many pharmacists or other individuals that have done that. So that's something that I think people will consider a legacy. In terms of my practice, one of the things I'm most proud of is we had one of the early private practices. So back in the 80s, we were being paid by our hospital to provide clinical pharmacokinetic services to patients. So that was exciting, and that led to much of my career in terms of teaching in that area, as well as you mentioned, I have a number of books that I've edited and written in that relate to clinical pharmacokinetics. So certainly that will be something that people will probably remember about me. Another opportunity that I had with ACCP before I became president was to chair the committee that put forth ACCP's position that, you know, all pharmacists graduates who were planning on providing direct patient care should do a residency. And that has obviously, I would say, it galvanized the profession and moving in that direction, but there are certainly a number of folks who don't, you know, who haven't agreed with it over time. But what I can guarantee is that there are way more students doing residence now than there has ever been. And that paper started it, and work that we did after helped advance that notion as well. So I'm definitely proud of that. Probably people will remember my Whitney lecture when I won the Harvey A.K. Whitney Award, because a lot of the residency programs require their residents to read those speeches.
Oh, wow.
Somewhere along the way, somebody will read my speech 20 years from now and suffer through it, but they'll have some remembrance of that. And basically that was about, you know, pharmacists becoming visible ingredients in patients' practice. So anything that I could do to help advance pharmacists being key players in the care of patients was something that resonated through my career. And then I guess lastly, you know, if I have happy children and happy grandchildren, that'll be an important legacy.
Very good. Thank you very much. And I'm glad you mentioned the Harvey Whitney lecture award you won. And actually in this course, they will get to pick one of the Harvey Whitney. They may pick yours because they will see a face and say, oh, I know that person. Well, thank you. The other question or other comments I'd like to hear from you is advice for students in their professional journey, how they develop as leaders. And you can give as much advice as you want within a reasonable time frame.
All right, let me get the clock going. By the way, I have gloves on because I'm sitting in my basement and it's freezing down here.
Oh, wow. Wow.
Why I look so bundled up in the middle of spring here. The first thing I would say is to be sure to volunteer, because you're going to meet amazing people who are dedicated to the profession. If you volunteer to be on committees, work your way up to serve as chair of the committees. Over time, if you're interested and you can make it happen, run for office at local organizations or state one or national organizations, all of those have to build on each other. I've often been asked, how do you get to this point to be elected an officer? And it obviously doesn't happen just because you want to. It happens because you've paid a lot of dues. But what I've always said is, whatever you put in, you'll get more in return. So don't forget that. It's well worth it. Go to pharmacy organization meetings. You'll leave those meetings, and I know students will already have been experienced with some of these things, but if you haven't done enough of it, make sure you're going to meetings, because you'll leave excited about the profession and ready to do new things that perhaps you hadn't thought about before. So pay your dues locally, statewide, nationally, however far you want to get to it. I guarantee the reward will be well worth the effort.
Very good. Any other words?
I think, mainly it's just, having the desire to advance the profession. And I hope everybody that's gotten into pharmacy wants to advance the profession. And the reason we want to advance it is because we want patients to be better served, to be healthier, to prevent disease whenever possible. So do the things that help advance the profession. It'll make your life better as well.
Very good. Thank you. Now, as this is a history course, in a few years when we're studying the decade of the 2020s, we will look at a key event in this decade as being the COVID-19 pandemic. And like other events in our history that has shaped our profession, this will be viewed as a major turning point, as an event that was a turning point in our profession. And in particular, would you care to comment about that? How do you foresee that being a turning point, especially an opportunity for our profession?
I think there are many things associated with it that are exciting for the profession. It's obviously a terrible event for patients. We want to do our best to help them. But we've already seen some positive outcomes in telemedicine related to pharmacy. So pharmacists are now allowed to work virtually with physicians. And you may or may not know, but telemedicine has been, it's been getting started, but it's not as well reimbursed as regular office practice. And I think this is such a great opportunity. I actually talked about this in my Whitney speech, so it's, in a way, it fits right in with that, in that we have to have the opportunity, particularly in community pharmacy, where we're kind of isolated from the other healthcare practitioners. There's an opportunity for this telemedicine and other technologies for us to work more closely with other healthcare professionals while we're in our positions, isolated in our community pharmacies. So I think we're going to see much greater ability to get information about our patients, much greater ability to work with others via telemedicine and other technologies. So that, to me, already shows the benefits that have come from this isolation that we've been put through. I also have seen renewed effort by, well, maybe not renewed, I think it's a continued effort by the various pharmacy organizations to make sure that pharmacists are recognized as healthcare providers. And I see this, this opportunity has been quite good for us to advance that message with better listening from some of the politicians and others that can help make it happen. And I think I've seen the major chains talking more about how important their pharmacists are to the public. Again, positive views. We do see it on advertisements no matter what. But my wife mentioned to me the other day that the head of Walgreens was on a news show and talking about how great the pharmacists were and how important they were in this epidemic. So I think those are the key things. I'm also excited about the fact that people are learning to do their work remotely. And I'm hoping we'll do a lot more of that and get off the highways. Quit wasting an hour each way driving to work in the big cities.
Yeah, exactly. Education. Yeah. Very good. Well, thank you very much, John. We appreciate your comments and your insights, and stay warm. I say stay healthy, stay, but stay warm. Thank you very much.